Hi, I'm Dr. Tama Cathers, and I'm here in Spain walking a pilgrimage trail called the Camino Ingles. I'm doing this after a diagnosis of coronary microvascular dysfunction. I'm hoping to raise awareness of these sets of conditions so that other people don't take as long to get a diagnosis and treatment as I took. It took me 20 to 30 months, and that's just too long. The information here is from a patient and layperson perspective. It shouldn't be considered medical advice. I'm sharing this information in hopes that it can help some people out there. Coronary microvascular disorders often don't show up on the typical workup for chest pain because they require a special test. I have coronary microvascular dysfunction and vasospasms. In addition, I have heart failure related to these conditions. I'm on medication, and it's at least temporarily very effective. Since I don't know how long the medications will continue to work, and I feel so great now, I thought that this would be a good opportunity to go on an adventure, and I'd heard about the Camino trail, which is a set of trails. I'm walking the Camino Ingles, and also an opportunity to raise awareness of coronary microvascular disorders. I do wish it had a simpler common name, like heart disease of small vessels. Briefly reviewing coronary microvascular disorders, please see my YouTube video number 3 for more information from me, or visit the INOCA international site, INOCA. They have great downloads that are very informative. There are about 4 ways, probably more, that the small vessels that feed the heart blood, and therefore oxygen, can have a problem. Those arteries can be thickened so the blood can't flow through at a normal rate. Those vessels can also not dilate when they need to dilate, like under pressure with exercise. Another thing that can happen is that the vessels, those arteries feeding the heart blood, can already be dilated at rest, or they can spasm and constrict, blocking off blood flow. All of these cause the heart muscle not to get the blood that it needs to function, and the heart responds by causing pain. I get a severe pinching chest pain. Sometimes it radiates up my neck, to my shoulder, to my back. Shortness of breath and dizziness, fatigue are all signs that can go with it. Because it's so tied up with heart failure, people can also have signs of heart failure like weight gain, pitting edema, shortness of breath. If you or a loved one have chest pain without a diagnosis after the typical diagnostics, like going to the ER, which you should do, they'll do a great screening for traditional heart disease, coronary artery disease. But if you still don't have a diagnosis after those tests, ask your physician to consider microvascular heart disorders. You may have to educate yourself about them. These disorders may not be on many good physicians' lists, as it's not well known, and testing has to be done at a specialty hospital with a special heart cath, a challenge heart cath, with provocation testing. Today, I'm going to talk about my medications. I've gotten a lot of questions on these, especially why I'm carrying what I'm carrying, why I'm having my luggage transferred, and things like that. So I'm going to show you a little video of that. My medications will be different than other people's medications, and that's okay. That's how it should be. We all have different disorders, and we have different physicians that prefer to use different medication regimes. I'll be talking about them because I'll be using them in upcoming posts. They're indicators of how I'm doing and how hard my day was. The medication I'm currently on is a beta blocker. This is being used to dilate the arteries that feed the heart. Most of the time, I feel pretty normal on this medication. I can even go hiking and go up inclines without any chest pain. However, when I have a flare, I have chest pain no matter what I do. I very much like my medication. Heart failure goes along with coronary microvascular dysfunction in about 70% of the patients. Heart failure and microvascular disorders are related by the endothelium, which is the lining of the blood vessels. Research is still trying to figure out the connections between the two, like the chicken and the egg thing. Which came first? Do they happen at the same time? And I don't think anybody has an answer yet. They're definitely related. So I'll be talking about the beta blocker that I'm on. I'll also be talking about a diuretic that I'm on. This is for the heart failure side of my disorders. A diuretic makes you pee off any extra fluid your body isn't able to get rid of because your heart isn't working properly. I have to set aside about 5 hours a day just so I can pee. This is a pain in the butt. For my hike, my physician allowed me to increase my beta blocker a certain amount for days that I am having difficulty during this adventure walking the Camino. For this hike, my physician prescribed nitroglycerin patches or nitro patches if I have too much chest pain, because these also help dilate the arteries, which may be constricted or already dilated in my case, so that I don't have chest pain with exercise. My reports may include whether I had to use a nitro patch or two, or if I had too much chest pain to press on. There's the possibility that I'll have too much chest pain to do this walk, and I'll have to do something else. But for now, this hike is my plan. So every day I take my beta blocker. If I have a pretty challenging day ahead, I will take an increased amount. If I take more, it's clear it does its job better. However, I only have about 6 more dose increases left before I meet the maximum that can be prescribed. I've been having to go up every 2 weeks, sometimes less than 2 weeks. That gives me 6 to 12 weeks to feel comfortable on this medication. After that, I don't know what. Since I feel like this is my chance to walk the Camino, I'm here and that's what I'm doing. I'm getting it done as best I can. I get to do it with my friend Margaret, and I'm raising awareness of these not uncommon disorders. So I feel like it's time well spent. Remember, live fully before you die. We're all going to die someday. So let's do good in the world beforehand.